exercise group. And the structured exercise here is really important because we know over these years that handing somebody a brochure and saying you should go exercise doesn't work. But referring patients to structured programs really does work.
Hi, Dr. J. Thank you so much for taking our time and being available today. I really appreciate your availability and flexibility for this conversation. So, I think a great starting point for our discussion will be if you talk a little bit about your vision and mission behind Cancer Fitness organization you have, the website you have, and I know you have a quite extensive experience in the medical field, in the healthcare domain. For the sake of our listeners, if you can explain a little bit what you are trying to accomplish using Cancer Fitness, I think this could be a great starting point for our conversation.
Well, first of all, it's a pleasure to be with you. And secondly, of course, I would be more than pleased to talk about what I'm up to. Just as part of my backstory, I am a retired surgical oncologist, educated and trained at the University of Michigan, and then focused my career on initially endocrine cancers, including thyroid cancer, and then subsequently breast cancer for the last 35 years of my career. So that's my background. Stopped operating about 5 years ago, but close to 8 years ago, I almost accidentally discovered the world of exercise oncology. We all understand what the word exercise is. We understand what the word oncology is, but I had never heard the term before. And in all of my experience in surgical oncology, I was really struck that I didn't know anything about the science behind all this. And so for your listeners, I think it's really important to go back to the late 1980s, and particularly starting in 1990, when PhD researchers in the fields of exercise physiology, kinesiology, and even sports medicine started studying the impact of exercise on cancer patients, starting at the time of their diagnosis through active treatment and into long-term survivorship. When I first brought this subject up to my colleagues, their first reaction was that I was talking woo-woo. This is just woo-woo, feel-good stuff, Jay. This isn't real science. Well, that was because my medical colleagues, my oncology colleagues, were simply unaware of all this accumulated research starting again in earnest really around 1990. The next reaction by a lot of my medical oncologists was, oh, this is a weight reduction program. No, it's not a weight reduction program. The impact of the science is so much greater than weight reduction, although that obviously could be a benefit. Right. And so what I've learned then over this last 7 or 8 years is up through last year there's been slightly over 3,000 prospective clinical trials, resulting in around 25 to 30,000 publications. Now, why didn't I know about these? And the answer was that, again, these were outstanding PhD researchers, but they were publishing primarily in their literature. Right. So all of these thousands of articles were appearing in the exercise physiology, kinesiology, and sports medicine literature. Frankly, it's only in the last maybe 3 years or so that it's finally started trickling over into the general medical literature, let alone into the oncology literature. And last year was the bellwether year of all when the challenge clinical trial was presented at the ASCO meeting. Remember, ASCO is American Society of Clinical Oncology. And their annual meeting is the largest gathering of medical oncologists in the world. It's held every June in Chicago. The challenge clinical trial was organized primarily in Australia and Canada. It involved stage 2 and stage 3 colon cancer patients. It actually took 20 years from conception to conclusion to do this trial. The patients, of course, got the needed surgery, got the needed adjuvant chemotherapy, but then nearly 500 in each group were prospectively randomized into two groups, a control group and a structured exercise group. And the structured exercise here is really important because we know over these years that handing somebody a brochure and saying you should go exercise doesn't work. But referring patients to structured programs really does work. During the first year of the 3 years of structured exercise, the patients participated on site at the medical centers. And then in the next 2 years, we were then very closely monitored, continued exercise and off site. And I want to emphasize we're not talking about training for the Ironman contest here. We're not talking about training for marathons nor 10K races. What we're talking about is moderate intensity exercise.
Right.
What is that? Exercising, a good example is walking briskly 5 days a week for 30 minutes, where you get your heart rate up over 100. That gives you the 150 minutes, which is the national and international recommendation.
Right.
And couple with that 2, hopefully even 3 days of resistance training. Right. That's what we're talking about. That's the national and international standard for what's called now moderate intensity exercise. Well, the results of the challenge clinical trial when presented at ASCO, I think there were roughly 10,000 people in the audience. It got a standing ovation because the study revealed a 37% improved survival in the structured exercise group, and a 28% lowered recurrence rate in the structured exercise group of either their original cancer, a different cancer, or dying from something else. So needless to say, the challenge clinical trial is what's really put all of the field of exercise oncology really on the map. And that's where we're at today. And the reason I started cancerfitness.org was that 90% of my oncology colleagues are simply unaware of this level of science that's been out there all these years. So my effort with Cancer Fitness is to then not only educate my own medical and oncology colleagues, but hopefully to also educate cancer survivors, their families, and others. That, my friend, is the story in a nutshell.
Thank you. This is so powerful, and all the history you shared. I think this is another reminder that how much time it takes for innovation or new ideas in healthcare to become popular and then get adopted. So it is another challenge, which again, the purpose for this podcast is exactly the same, that we want to bring such kind of content out there within our power, where I think if we are able to create enough buzz, enough noise for situations like this, for knowledge like this, I think it may help improving the overall healthcare system. So I want to ask you a little bit more about Cancer Fitness website you have. I think if I understand correctly, your vision or mission is a non-profit website, a community, a collection where there should be more and more data or more and more videos or literature available for exercise oncology, not only for doctors but also for patients as well. Is this the vision, or you are also looking forward to maybe converting it into some sort of applications or a profitable business as well, or you want to keep it non-profit moving forward?
Good question. In many sense, I've been building the plane as we're flying it. I really have been. I had the idea. I knew we needed to educate my colleagues and patients about all the science. I mean, my goodness gracious, if we had this much science for a new surgical procedure, it would have been a standard of care 10 years or more ago, okay? And I think it's really important for your listeners to understand that medicine has to be evidence-based if it's to be credible. And you're right, it does take considerable amount of time to accumulate evidence, particularly when it's not a drug-based evidence or a new surgical procedure or a new form of radiation therapy. And naturally, just like my colleagues 7, 8 years ago thought this was all woo-woo, there's a natural resistance to this kind of effort, if you will. Many people have thought about exercise as simply being something we all ought to do, but didn't realize that exercise could literally be medicine. One of the things to finish my story, and then I'll answer your question, with all this research for 35 years of improved clinical outcomes, the question then is, wait a minute, what's going on at the physiologic metabolic level in our body to give these obvious improved clinical outcomes? Right. Because it's patients do better during active treatment. They have less depression, less anxiety. I mean, just the benefits just go on and on. Right. That's where the research is now focusing. The research is now focusing at the molecular level, and so far at least, we know two important systems in the body that are affected by moderate intensity exercise. The first is our muscles. Right. Every time we moderately exercise, our muscles are releasing things called myokines. M-Y-O-K-I-N-E-S, myokines. Myokines are proteins, polypeptides that are released and circulating in the body. We've learned that the myokines have a very strong anti-inflammatory effect on the body. And we know that chronic inflammation is one of the things that can cause cancer in the first place, let alone cardiovascular disease and other forms of disease. But we also know that chronic inflammation can help increase the chance of a cancer recurring. So the fact that myokines can have an anti-inflammatory effect may be one of the biggest impacts of all of moderate intensity exercise. More to be revealed. Right. We also know that if you take the serum from people who are exercising moderately, like we've been talking about, and add that serum to cell culture lines of cancer cells. There was a very famous study done in Canada a couple of years ago in prostate cancer patients being closely monitored. They didn't have surgery, but their PSAs were being closely monitored. In the exercise group, the PSA levels were going down slowly. In the control group, the PSAs were either staying the same or starting to gravitate up. When they took the serum from the control group and added it to the cell cultures growing prostate cancer cells, there was no impact on the growth of those cells, one way or the other, either increasing or decreasing, as I understand it. However, when they added the serum of the structured exercise group patients, the growth of the cancer cells in culture decreased. So there may be an actual direct impact on the growth of cancer cells, okay? Let alone the moderate intensity exercise benefiting our cardiovascular system, respiratory, central nervous system, etc. The other system in the body that's being impacted in a big way by moderate intensity exercise is actually the immune system. If you think back to the COVID pandemic days, those who were in much better physical condition did better throughout the pandemic, didn't they? In many sense, the pandemic was like a Darwinian event. It was culling the herd, if you will, that the less fit ended up passing away, where the more fit survived, and survived in a big way. So we know the immune system is enhanced by moderate intensity exercise. And this can have a direct cancer, anti-cancer effect as well, because of the release of macrophages, killer lymphocytes, T helper cells, etc. So more and more research is going to be focused on these two areas. And if the future of cancer treatments are going to be more and more targeted immunotherapies, then perhaps it makes sense to enhance the immune system prior to actually giving the immunotherapy and therapies. And that's where some of the active research focus is right now. Now, getting back to cancer fitness, as I said a couple of minutes ago, I feel like I'm building the plane as I'm flying it. We've grown considerably in our visibility. I can provide you numbers subsequently. I don't have them handy with me right now.
Right.
We're increasing the awareness dramatically. We're not selling anything right now. This has been something I have funded strictly on my own. And it was recently granted 501c3 status by the IRS. So I am officially a not-for-profit. So my answer to your appropriate question is more to be revealed as we continue down this pathway.
Makes sense. Makes sense. Thank you. And in your opinion, how can hospitals or healthcare systems can integrate exercise as a part of caregiving? What should be the process, or what will it take for them to at least start using exercise as one of the medium for recommendation to their patients?
Yeah, a great question. The barriers to full implementation of this have been two things. Number one, the lack of knowledge of my own colleagues, let alone hospital and cancer center administrators. The benefits are enormous. Patients love it. There's higher retention rates, and there have been some preliminary studies out that actually show a meaningful return on investment. There is an ROI for hospitals that have their programs, particularly in patients who have 2 or 3 or more comorbidities already. Okay, that data is out there that there is a ROI benefit. The other obvious barrier here is the lack of reimbursement. Both ASCO, the American Cancer Society, the American College of Sports Medicine have been dealing with CMS over the past 2.5 to almost 3 years to try and get a code for exercise oncology. It's very, very similar to cardiac rehab. In the prior administration, we were very close. We went through 2 drafts with CMS. And the final report from CMS was coming out right after the inauguration last year. Needless to say, with the inauguration of the Trump administration, everything blew sky high. And so we still don't have reimbursement. So the major barrier has, for many cancer centers, has been the lack of reimbursement. However, physical therapists can start these programs, and they are qualified health providers. They do have the deconditioning codes, sarcopenia codes, and others. But frankly, on most physical therapists, probably close to 90%, are primarily involved in orthopedic-related issues. So there hasn't been enough interest in the physical therapy world to really get them more involved in this. There are some really excellent cancer rehab programs in the country, but other than lymphedema specialists, there just hasn't been that big an interest. I'm involved with Maple Tree Cancer Alliance, which is a not-for-profit from Ohio. Maple Tree provides certified trainers, oncology exercise trainers, to approximately 90 locations in the United States. Most of those are funded by the foundations of the hospitals. And in some instances, the programs are so successful, they've actually been blended into the overhead of the running of the cancer centers themselves. I think the momentum is going to continue. I think there will be reimbursement eventually and codes from CMS. I think it's just a matter of time. I think the science is so overwhelming, we just can't deny it much further.
Right, makes sense. So in your experience with this, everything is changing with respect to artificial intelligence and all the digital transformations that are happening if we consider last 1 year or so. So in your opinion, in your experience, how do you see this landscape of exercise oncology changing in terms of AI helping out, or do you feel that it is a field which will be least impacted by AI and all these great engineering advancements that's happening?
Well, I think the whole world of cancer is going to be benefited enormously by AI. Its ability when it comes to organizing clinical research projects and things of that sort, reviewing literature is
Right.
unprecedented. So there's no question, in my view, that new therapies, new treatments, and others are going to be great. Our chances of finding them are going to be greatly enhanced by artificial intelligence. I should mention for your listeners that at Maple Tree Cancer Alliance, about 45% of the programs that Maple Tree offers to patients are actually delivered virtually. And so there may be an increasing role for the virtual delivery of these programs with artificial intelligence. And certainly when it comes to processing the data, at Maple Tree, we get baseline data on all patients. We create individualized, personalized prescriptions for each patient based on their baseline ability to exercise at all, what they've been doing, what their cancer is, what their other health issues are. And AI may be very instrumental in helping to just speed up the gathering of that data and coming up with individualized prescription programs. It's also important to emphasize to your listeners that this is a continuum of care.
Yeah.
Okay? But many, if not most, invasive cancers, patients who have had them, are really beginning a lifelong journey. This is particularly true in my world of breast cancer, where you can see long-term recurrences well over 5 years, 10, 15, even 20 years down the road. This can be true with other cancers, or we also know that if a patient's had one cancer, whatever it is, they're at an increased risk for a different cancer over their lifetimes. So this is really a lifetime journey. And what we're hoping to do is getting people in the habit of moderately exercising, not only during their treatment, but particularly into long-term survivorship, and really carrying that for the rest of their lives. A lot of this is about the discipline of lifestyle medicine. And the American College of Lifestyle Medicine, ACLM, is certainly getting more and more into this world. So it is a lifelong journey, and I think more to be revealed and where AI can really help us with that journey.
Absolutely. And I think, Dr. Jain, in my humble opinion, exercise is not only going to be helpful in treatment, but it can also act as a preventive mechanism as well. So if we start adopting it as early as we become aware of its importance and how fruitful it is, I think not only in oncology or cancer, it can be very much helpful to us in preventing a lot of diseases as well. So I believe if we make more and more buzz about it, more and more awareness about it, it is not only going to help the current patients, but also it can help the general population as well.
Absolutely. You're spot on. I'm glad you were, as we finish up our talk here, that we're closing with that, because you're spot on. It's estimated by the World Health Organization that somewhere between 35 to 40% of cancers are preventable, let alone the prevention of cardiovascular disease, type 2 diabetes, degenerative disease, Alzheimer's. There's more and more research going into Alzheimer's prevention with exercise. It's across the board. So you're absolutely right. The World Health Organization is predicting, if I remember the numbers roughly correctly, I think about a 35% increase in cancer globally over the next 10 to 15 years. And you say to yourself, what is going on here? Well, the population of the world is becoming older because we have been able to so successfully treat diseases that kill people at a younger age. The population of the world is becoming more sedentary. The population of the world is becoming more obese. The population of the world is becoming less active. less socially connected. So all of these factors added together, you're absolutely right. And we have more and more practitioners now who are specializing in the world of lifestyle medicine as a way of preventing all disease, let alone cancer. So thank you for asking that question. It was great.
Thank you, Jay. Thank you so much for sharing your wisdom, your insight, and what you are trying to do is very powerful, is very pure. I believe this is all about awareness. Uh, I think with more and more awareness, I'm sure we all are going to make good impact on healthcare. I really appreciate your time and all the wisdom, and especially everything you shared was backed by data, by research, by a lot of compelling information. So I'm sure it's going to be very useful to our listeners, and I think it is also a small step from our end in creating more and more awareness around exercise oncology. So thank you for taking our time.
It has been truly my privilege. Thank you very much.